$50 to any patient who is willing to leave here right now. Leave for $50. They're not all that sick.
Can I have the money?
Look, it's monogrammed.
How can we make this more interesting for you? I'll pay you $10 for every patient you diagnose without touching. You pay me $10 for everyone you have to touch.
I have to do this myself.
It's just rough. Can't you feel it?
Start counting. You owe me 30. I owe you 10.
He lost $20 on one patient. If only that were the first time that House had spent money to touch a woman. Very excited to be reacting to House MD Season 3, Episode 12, One Day, One Room. On this channel, we are reacting to all 177 House videos. This would be episode 74. Let's see if I can get the diagnosis before House does as a doctor working in London.
Next 2 days, you'll be doing nothing but clinic work. You owe me. I kept you out of jail. I can put you back.
Perjurer.
Felon.
I think I have syphilis or gonorrhea.
I think I have an STD.
I think I have a...
This is so accurate. I've seen more tips than a waiter. If you're wondering why House is stuck in clinic duty, it's because he stole drugs from the hospital pharmacy, got caught, then Cuddy had to fabricate evidence to get him off the hook. All of that is bad news for gonorrhea because it seems like House is on eternal clinic duty this episode. I run clinics not dissimilar to this one, so what do we see? Well, 40% of our patients are actually mental health patients, 30% are musculoskeletal problems with knee pain or twinging your back, high blood pressure is about 5%, cough around 4%, and genital problems around 2%. I see around 30 patients a day, 150 a week, so you can do the math, around 3 genitals a week. Strong start.
Who is here for a runny nose? Go home. Those of you who have stayed obviously do not have colds. You will be assigned a doctor who is not me, because I'm tired of wiping crotches.
Took 5 cc's of haloperidol to get him down after the paralytic wore off.
Pain in his right ear, psychotic behavior, and dizziness. Go.
Acoustic neuroma that started a hemorrhage.
Get an MRI.
The one day House is stuck in clinic, an interesting patient shows up. I know the diagnosis already. Paid actor to get House out of clinic duty, although he'd have to sign a Kevlar strength waiver to agree to be paralyzed, sedated, and intubated. An even stronger one than flu camp, where you get paid £3,000 to be barricaded in a 4x4 meter room for 10 days and infected with flu. You do get decent food and a PlayStation though, so it's not all bad after you get woken up at 6 AM for blood tests. Aside from being possessed, what could cause this man to start screaming and clutching his head? Foreman mentioned this idea of an acoustic neuroma which has suddenly started bleeding. It's a type of tumor which sits on a nerve called the vestibulocochlear nerve that controls hearing and balance. He was sat in the clinic room, so maybe those were the symptoms he was here for. What else could it be though? A subarachnoid hemorrhage is sometimes described as a sudden, severe, spontaneous hemorrhage that is so painful people turn around to see if they've been punched in the head. Having an aneurysm popping can cause it. You definitely want a CT head first to rule out things like that, as it's way faster than an MRI and is good at spotting bleeds. Let's see what happens.
What else?
Lingering ear infection. Pressure builds up in his inner ear and bursts through the mastoid bone while he's waiting in the clinic.
Get a head CT. While you're at it, pour some alcohol into his ear and take out the cockroach.
Why are we doing the tests?
Well, it's either that or I have to keep doing clinic duty.
A cockroach in his ear! This patient's clearly not been doing his ear kegels. In all seriousness, American cockroaches are actually way too big to fit in the tight ear canal. Cockroaches can find their way inside your head flaps though, if they're German cockroaches, as they're usually only about 1.5 centimeters long. I've had to pull insects out of people's ears quite a few times, and in all fairness, they do look similar to this guy in the waiting room, and understandably so. So how did one of my patients get an insect in her ear? Well, she had left the window open after she was having a shower, and a fly flew straight into her ear. She had no idea what to do, so she came straight to A&E, and it was properly stuck. Poor woman had to sit there for 3 hours with this thing buzzing inside her ear until they called me to see her. When I saw her, I drowned the bug with saline, then used suction to pull it out. You can use vegetable oil as well to kill it so they don't scratch your eardrum and cause permanent damage. What's even more shocking than that though is House is now asking for a CT and an MRI at the same time in the same patient. To practice with infinite resources.
Why are you here?
Because it's not a hospital.
How can I help you?
The doctors gave me this.
Patient has a 6-centimeter mass in the right lung. Cancerous, inoperable.
Is it okay if I sleep here tonight?
What are you doing here? I thought House had a case.
He doesn't.
You ordered a CT on a patient with a bug in his ear. You are going back to the clinic or jail.
I think I'd rather go to jail.
You owe me.
You use toenail clippers up there? You've got athlete's foot in your nose.
That's like saying you've got golfer's elbow in your knee because you have tendonitis, or you've got pink eye in your buttock if you have an abscess. Same organism. Athlete's foot is caused by a fungus. It's in the same kingdom as a truffle, but not quite as tasty. The funguses that cause athlete's foot are called dermatophytes, and infection with these fungi in different parts of the body are called different things. The foot is athlete's foot, the scalp is tinea capitis, the body is tinea corporis, or in the crotch is jock itch. The phrasing it the way House does though makes for interesting television. So a question for you smart people: what causes people to get athlete's foot? See how many causes you can name down below.
$50 to any patient who is willing to leave here right now. Leave for $50. They're not all that sick.
Can I have the money?
Look, it's monogrammed.
How can we make this more interesting for you? I'll pay you $10 for every patient you diagnose without touching. You pay me $10 for everyone you have to touch.
I have to do this myself.
It's just rough. Can't you feel it?
Start counting. You owe me 30. I owe you 10.
He lost $20 on one patient. If only that were the first time that House had spent money to touch a woman. Running a game like this in person though obviously would be beyond malpractice. We spend enough time worrying about missing a cancer while we can examine patients properly, never mind diagnosing blind. That being said though, technically you could diagnose probably 9 out of 10 patients correctly based on history alone. And this is kind of the type of thing that we were doing during the COVID-19 pandemic when all of these telephone consultations and telehealth started being introduced. Every now and then though, you lay your hands on a patient and the examination tells you something that you didn't expect. Like 2 weeks ago, a 52-year-old patient was telling me that they had a cough and a chest infection recently, which she was given antibiotics for, but the dry cough lingered on. No weight loss, no blood, and a non-smoker. Before examining, I thought this will just be a normal post-chest infection recovery process, but when I looked at the back of the throat, the tonsil had a hard mass growing out of it. She had tonsillar cancer. It was good she came in when she did because hopefully we got it early enough, but we're still waiting to find out how extensive her disease is. That gave me a scare as it could have easily been missed. Thankfully, nobody plays House's game in person though, I hope.
Every patient who comes in here for an STD test has one thing in common. They had a SWS. Sex while stupid. How do you live to your age and not know about condoms?
I have an STD.
All you gotta do is take these pills.
Don't touch me!
I need someone to cover a patient. She was raped.
Oh, that's horrible to hear, but sadly it does happen more commonly than we might expect. Around 97% of women have been victims of sexual harassment and 1 in 25 victims of rape. That is less than the true stats though, as most people don't actually report it. The majority do happen while under the influence of alcohol and with the perpetrator being a current or ex-partner of the victim. One serious but horrible consideration though is if she got chlamydia, could she also have gotten pregnant? We know abortion law has been a point of contention in the US recently, but in these cases, even in the US, 75% of people agree abortion should be allowed. Now, many states that ban abortions have exceptions for cases like rape and incest, but the reality of the situation is very different. Like last summer, a woman from Mississippi was pregnant from a rape and couldn't find a doctor to actually provide an abortion. I wish that were the only cases. Part of the difficulty there is how do hospitals prove or at least make it highly likely that a rape did occur? They need a police report, and we know that 2/3 of victims won't report the crime to law enforcement because they know the person who committed the act and are worried about what's gonna happen. Definitely an unsettling time in history.
I didn't mean to upset Dr. House. I like to keep being treated by him.
I don't want to treat you. There's nothing to treat. You're physically healthy.
I trust you.
You were raped. All control was taken away from you. You're trying to find that control again. You want me because I don't want you.
I'm raping you. Get the hell out of here!
I didn't consent to all this medicine. I'm dying. There's no treatment for dying. Stop the treatment.
I read about a treatment.
some doctor won a prize for it?
Anal digital stimulation.
It takes a serious lack of care for House to straight up tell his rape victim that he just doesn't want to treat her. Reminds me of Elon Musk's biographer talking about his demon mode when he can be brutally honest to achieve a task.
He gets into a trance and he can just be tough in a cold way. He never gets really angry, never gets that physical, but coldly brutal to people.
Now, the last patient was faking having hiccups that wouldn't go away. Why? He was trying to get House to give him a free prostate massage. Believe it or not, that actually works for hiccups. There was a case from the 90s where a 60-year-old patient had pancreatitis. They needed to put a tube through his nose into his stomach, and he got persistent hiccups afterwards. They tried everything to help, including drugs like chlorpromazine, but they still came back. Eventually, they were at their last straw and gave a rectal massage, which got rid of the hiccups for a few hours. Then they came back, so they repeated it and they went for good. So if you get more stimulation from this channel than a cure for hiccups, then check out my channel membership. You get early access to new videos, access to exclusive polls, and to suggest a season and episode for me to react to. The first 30 members have a chance to win a 1-hour, one-on-one tutor session with me on a topic of your choice. We currently have 28 members with just 3 spots left, so press join now to secure your spot.
I paid these people $50 to leave here an hour ago.
The kid needs surgery. He swallowed a magnet.
It's already below the stomach. It should pass on its own. It's well into the intestines.
I need a crash cart. Stat!
What happened?
Pills, benzos. I gave her a couple sedatives, turned around, she grabbed the whole bottle. I was with her for over an hour. She didn't say one word.
You're gonna be okay, physically.
Which is all that interests you. You're here.
After all this happened, I feel like Universal wants to take us on House's journey of finding his humanity. This patient has been attacked, there's no intellectual challenge to trigger House's curiosity, and the patient has no logical reason to want him specifically as her doctor. He's the archetypal pure thinker, she is the archetypal pure feeler. People are naturally inclined to one or the other, and the Myers-Briggs personality scale has this difference as one of their 4 domains. Even though people are naturally inclined to one or the other, they can learn how to use their less natural parts. That's important because there's no better or worse when looking at these different personality types, although thinkers on average do earn more than feelers. As we can see from this episode's situation though, some situations do need a more gentle approach. There are gender differences with this as well, with 75% of women being feelers and around half of men being thinkers. This is part of the reason why working in teams of different kinds of people works so well. A thinker may look at a problem in a different way to a feeler, and likewise with all the other Myers-Briggs domains. Will House be able to train his sensitive side? Let's find out.
You tried to kill yourself because you couldn't talk to me. You must have a reason.
Why does there always have to be a reason?
You want to talk about what happened to you?
No.
The weather?
Yeah.
I'm not going to talk to you about the weather. You help her.
She wants you.
She wants normalcy. She wants to feel like the world didn't end.
You need to get her to talk about what happened. So she has no choice but to process it.
I just want to talk.
About nothing. Nothing will change.
Time changes everything.
Doing things changes things.
Interesting how there's such a divide in the team here, with Foreman happy for her to be distracted and skirt around the issue, but Cameron wanting House to tackle it head on. With this, there is a right way and a wrong way to do it, and suppressing the memories and trauma, pretending it didn't happen, won't deal with the root source of the problem. It just will resurface at another point like a helium balloon held underwater. That doesn't need to be about something huge and tragic like rape, and could just be acknowledging and sharing your feelings about the dishes being left or Amber leaving a turd on your bed. Women are generally more emotionally expressive than men, but when do those differences arise? Associate Professor of Psychology Tara Chaplin wrote about this extensively in her 2015 paper. Looking specifically at young boys and young girls, there are already biological differences in emotional expression. Young boys have higher levels of basal stimulation, and young girls develop language skills much earlier. The stereotype then of boys using active play and rolling around with each other while girl groups sit quietly at their tea party then holds some scientific merit. There is another side to it beyond biology though: socialization. By learning gender roles, children associate certain behaviors with that role by learning, observing, and experiencing. That can teach children the associated behaviors with the specific gender, like boys are active and tough, then developing that for their own role, like Boys are tough and active, so I'm gonna go play Spider-Man instead of changing a Barbie's clothes. It's easy to then see how boys would be expected to show less of the tender emotions like anxiety and sadness, instead expressing more aggressive emotions like anger and dissatisfaction. This mixture of natural biology layered with socialization is called the biopsychosocial model of emotional expression and extends into adulthood. We know that men naturally feel either the same or more than women in response to an emotionally arousing stressor, even though they express less. That indicates that they would keep in emotions that women would freely express. Women do internalize more negative emotions like guilt and sadness and are more likely to be expressive of positive emotions though. Ultimately, these differences can lead to high levels of depression and anxiety in women, but antisocial behavior or alcohol abuse in men. Moral of the story, whether they're negative or positive, it's important to share your true feelings.
Why do you have to suffer?
My father. He said I would die alone and miserable. Why did your husband have to suffer?
How do you know about my husband?
I just know.
Did the nurse tell you about my husband?
Yes, I was just trying to freak you out. I need somebody to remember me.
I'm loving the format of this episode, very unconventional, and I can see why many people have recommended it. 2 patients, unconventional challenges, and a lot of character development, so much potential. Now, our second patient seems to be a homeless man who's diagnosed with cancer and needs a bed for the night. We found out earlier that he feels the need to suffer, and maybe now we know why. To be remembered. That is an intimately human desire that drives people to donate millions to have hospitals named after them or get a statue erected. Is that truly the meaning of life though? To be remembered? If it isn't, then what is? All we are is a speck of life floating on a molten rock throughout the galaxy, one of 7 billion other people that we share it with. When thinking about this question though, I think we're asking the wrong thing. The real question isn't what the meaning of life is, it's what we can do with our lives to give them meaning. That could be giving joy to your friends and family, sharing knowledge to the next generation, pursuing a challenging goal, or posting medical videos on YouTube. Maybe this patient missed his opportunity to find those things. Maybe he made some mistakes on the way. Either way, we still have time to change that so we can find it for ourselves.
What was your major?
Comparative religion. Has anything terrible ever happened to you?
I sedated her. I don't know how to answer these questions.
Tell her the truth.
Tell her your life has been good.
Keep her asleep. You're gonna base your whole life on who you got stuck in a room with?
It's what life is. It's a series of rooms. And who we get stuck in those rooms with adds up to what our lives are.
She's pregnant.
Termination procedure isn't pleasant.
I don't want to terminate. Abortion is murder.
This is exactly what I was afraid of, and she wants to keep the pregnancy. Of course, that's her choice if she's of sound mind with the capacity to make that decision. Is she fully assessing the impact of her decision though, since she said abortion is murder? Sounds very politically and principally charged, but is it true? Is abortion murder? Well, we need to answer 2 questions to understand the answer to that. 1, what makes human beings human? And 2, at what point does life start? To answer the first question, it's our brain with its intellect and consciousness, or even soul from a spiritual sense, that makes a human a human. Without the brain, there is no personhood. So when does life begin? Some argue it's right at fertilization, but can we call a ball of cells that early a person? How is that so different from a cell culture on a petri dish or a collection of used tissues? The fetal heart only starts beating at 6 weeks, and the brain is just starting to develop at that point. At around 24 weeks, that's when the baby's brain is developed. In the UK, we give a fetus personhood at that point, where they can reasonably survive outside the womb, which is 24 weeks. After that point, I could agree abortion is murder. I think there is a grey area between 6 weeks and 24 weeks where, it could be argued either way. But at say 2 weeks, then if you say abortion is murder before the heart started beating, then you're working on potential, and then not getting pregnant every cycle should be murder as well, and so are wet dreams. So it's definitely a point of great contention, so let's see if she sticks to her guns.
You should end it.
Every life is sacred.
What about Hitler? Is his life sacred to God?
I don't want to chat about philosophy.
It's murder. I'm against it. You for it?
Not as a general rule.
Just for unborn children?
Yes.
You don't deserve pain. You're just an insane
No.
man. I'll remember you.
Why?
Because you're a nice man.
You don't know that. I just need to die knowing that something is different because I was here.
If you believe in eternity, then life is irrelevant. You need to think that the guy who did this to you is going to be punished. Why did you choose me?
It's like you heard too.
If you're wondering how they got outside, it's because House decided that they would go for a walk. And I'm glad they did, because this is exactly how group therapy works. You can relate to someone else who feels the pain you feel much more than speaking to a doctor sat behind a mahogany desk. This is just chipboard, by the way. Patients feel more safe together as they're not the only vulnerable ones. We know that in general, patients want to be perceived as good people and they're scared of judgment. That risk shrinks when you're all in the same boat. The hard part though is getting people to actually attend. In my surgery, we actually set up an online diabetes education group session where patients could share their challenges and how they've overcome them. Less than half the people who signed up actually arrived. When something like that happens though, the only constructive way to deal with it is to blame yourself. What could I have done to make sure those patients actually turned up? Sending reminders, hosting it in a physical venue, giving good education on the importance of diabetic control, or offering foods that's hopefully not too unhealthy. These things all make a big difference. We know they do, as at one point the surgery's physical reminder messaging system broke for a day and I had 8 people booked in my clinic and only 2 turned up. It's a shame Cameron had to watch that poor guy die in pain, but at least he was in hospital with someone caring for him rather than being out on the street. But question for you smart people, what's the one main thing that gives you meaning in life? Answers down below.
It was true.
Who was it?
It's my dad.
I'd like to tell you what happened to me now.
She terminated. She's been discharged.
He convinced her to have the termination. Obviously a horrible procedure, but for the best in the long term. And all it took was for House to admit that he'd been abused before himself. That reminds me of what FBI negotiator and award-winning author Chris Voss says in Never Split the Difference. Reciprocity is one of humanity's strongest forces. A store gives you a free sample. You're thankful and want to return the favor. House shares his story. He shows his vulnerable side and the patient wants to do the exact same. The more people are heard and understood, the more they will listen to what you have to say. Most of the time when we try to change someone's behavior, we get angry and frustrated, telling them about the impact they're having on those around them. We need to take the time to listen, evaluate, explore their thoughts and feelings without judging. Nobody can force someone else to change, but you can guide them to the decision to change themselves. A patient I had recently was resisting quitting booze as it was part of his identity. His family kept getting upset and annoyed with him, which just amplified the problem. I took the time to use the above strategies and after 20 minutes he agreed to be referred for help to quit. All people want is to be heard and understood. Brilliant episode, what an existential trip. 9 out of 10 entertainment, 9 out of 10 accuracy. There was no diagnosis, so I can't really rate that. This episode makes way more sense when you watch the previous one here where House is taken to court. Watch now.